Hey girl. I've obviously created quite a lot of content today, which is why I'm wearing the same sweater. I just wanted to create some shorter videos because I know that the original introductory video is around 38 minutes long. So just some of the things that I used, prepped, I thought I would share with you. Obviously, I think if you've watched the first video, you will know that I am just wearing a belly band that was supplied to me by the hospital, and I spoke quite in depth on the main video. I didn't have any lipo. This is what was supplied to me and I found it very, very useful rather than a faja. But do listen to your physician and your surgeon, because it might be different to what is recommended to you. Remember, each individual journey is personalized, individual, and it's not a one size fits all. So do check with your surgeon what's going to be best for you. This was, for me, much better, and it's given me the right amount of compression that I need. I spoke about meds, so I've just been taking the Tylenol extra strength. But I say I've been taking it, I haven't taken it since around 24 hours in, but I took this for around 4 days. Again, you know, your journey might be different. You might not take it for as long. You might end up taking it further. So that was the Tylenol. So this was my over-the-counter pain medication. Then these are the 3 medications that were provided to me by the hospital. So make sure that you get your prescription meds delivered to your pharmacy ahead of surgery. Don't get left like I did when they didn't have my main pain med, because you're going to need that on day 1. So the main pain med that I was prescribed was Oxy. You know, you need to be very careful taking Oxy. You know, it can give you an opioid addiction. You can also obviously overdose yourself as well. So make sure you read up. If you're worried that you've got an addictive personality, or, you know, you've suffered from maybe addiction or drug use in the past, talk about that with your doctor, because they might want to prescribe you something else. The other 2 things that I was prescribed was a anti-nausea and vomiting. So I did feel very nauseous in the first 24 hours, which I haven't spoken about previously, but you might want to take these. Yeah, I did feel nauseous to begin with. And then the last one is a stool softener. So you're going to want to use this alongside taking a laxative. I obviously spoke about taking a laxative, so it's not a one or the other. Take both. So the stool softener, and then I just took a CVS laxative. So make sure you take this from when you get home, and whatever the maximum you're allowed to take, do take that. Don't think that you're going to be okay. The anesthesia and the surgery really does play havoc on your bowels and your digestive systems. Just help yourself out. And then the other, so I haven't got the arnica on me, but I did, like I think I mentioned earlier, I only took it for 1 day and then just forgot to take it. And then the other thing was bromelain. So I ate a lot of pineapple and I drank pineapple juice. I've drank 200 mils of pineapple juice every day, and I had 1 to 2 cups of pineapple a day. So if you're going to eat the whole food, I don't really know how much you need to take the bromelain. I bought it and I took it for 2 days and stopped taking it. So essentially just wasted my money. So I don't know if it's how necessary it is. It's an extract that's 100% taken from a pineapple. So if you're going to do what I did and actually eat the whole fruit, I'm not a dietitian, I'm not a nutritionist, but I'm not sure how much you need to supplement if you're eating the whole food. And I generally think, as a rule of thumb, eating the whole food is better for you. And then one thing that I've recently started taking is Spoiled Child. So this is a liquid collagen. I have no idea if it's actually doing anything for my hair, skin, but I thought I would start giving it a go, and I'm about to start my second bottle. So this is a whole bottle. Hopefully it's doing something for my hair and skin. In one of my early on videos, you're going to see that I actually did a chemical skin peel. So my skin looks okay at the moment. I'm due on that time in a month, so I'm really spotty at the moment around my jawline, but sometimes that does happen around my period. So one of the other things I forgot to say is make sure you've got some band-aids, because when I had my drains removed, it obviously left two on each side, because I had one on each side, and I know some of you might not have drains, but I did. It left an opening when it came out. The surgeon did put a dressing on top of it, and he said when you shower and take the dressing off, you're going to need to put a band-aid on top of the open wound. So band-aids, make sure you've got some. That's a plaster for you Brits out there. Yeah, we call it a plaster, Americans call it band-aid. On this occasion, I think band-aid probably makes more sense than plaster. I spoke earlier that I've actually taken it apart because it was I've just put it through the wash. So I spoke about the fact that I had a drain belt. So this kind of clipped around my waist, if I can put it together, and then it just had two bags hanging off. I've only got one because the other one's in the wash, off of each side, and that kind of went around my waist and supported each drain. And then I said about a meal prep service. So week 1 I was using Factor, and I actually used that on week 2 as well. I've paused Factor for a week, and I'm giving Cook Unity a go this week. So they both seem as good as the others. Cook Unity is more of a professionally prepped meal. It says who's I can't even think of the word. It said whose recipe, that's it, whose recipe that is. So I had 12 of these delivered for around $80 on a 50% off, and I had 18 of these delivered for around $110. So I'm probably just going to go back to Factor as of next week, but I just kind of wanted to save some pennies and try the Unity deal. Now I think the Cooked Unity food is absolutely delicious. I'm just not quite sure if I'm going to be able to get it when I move down to Charleston, South Carolina, so I'll probably be moving back onto Factor. I'm not sure. I do enjoy cooking. I'm going to have a very busy few weeks when I first move there, so I'm not sure I'll get 18 delivered every week, but I might definitely continue my Factor subscription and just get a smaller amount delivered as an option for 2-3 days a week, because I am a single mother. I work as well, so I'm super busy. So they're just a few of the things that I recommend. The things that I haven't shown on there is, like I say, I drank 200 milliliters of pineapple with my spoiled child mixed in collagen every day, and I had 2 cups of pineapple every day. I ate a lot of like hummus and balsamic and roasted tomatoes on sourdough, and very whole food. So I tried to keep my foods to whole nutritious foods, tried to keep my salt intake down, and I forgot to mention earlier, I actually tried to stay away from as much dairy as possible for the first 5 days. So I usually will have dairy in my coffee, and I had a coffee every single morning. That didn't change. I only have one a day, but I enjoy my coffee in the morning. Usually I'd have like a 2% lactate. I'm not lactose intolerant, but I do have lactate milk. I switched to oat milk for the week because dairy also can play havoc with your digestive system. So if you're already experiencing constipation from the surgery and the anesthetic, the last thing you want to be doing is eating foods that are going to add to this problem. So just think about eating lots of fruit and veg anyway. You need to be getting as much nutrient dense food in you as possible. Whole foods, whole grains. You're going to notice that you can't eat as much as you might normally eat because you get very full very quickly. So you're going to kind of have to limit your food to, I'd say, little and often. You know, you're recovering from surgery, your body needs calories and it needs nutrients. So although I've been careful to be quite calorie restrictive, because I've as of this week, I'm going back into a very small deficit because I want to slowly lose a bit of weight. And I say slowly because with a surgery like this, you need to be pretty close to your goal weight. And you don't want to be making any drastic changes. So because I'm not exercising like I normally would be, I'm on a slightly calorie deficit because I would like to lose a teeny tiny bit more weight. And it's also very easy to kind of get bored and find yourself going back into the fridge because you're bored. So I did eat little and often because that's kind of what my body allowed. But I have been tracking my my food intake on MyFitnessPal. The first few days I didn't really have a problem because my appetite was very low. I think day 4, day 5, I kept finding myself going to the refrigerator bored, and I was kind of realised that I'd eaten a lot more than I thought I had by just snacking. So I kind of had to get myself back in check a little bit. And one of the main important things to drink is lots and lots of water. Earlier I said that I was drinking bottled water to make sure that I just had bottles and I was drinking lots. Now I'm back to being more environmentally friendly, and I'm trying to drink as much water as possible. Obviously we need to drink water anyway, but post-surgery, water is going to be one of the most important things for your body to heal itself. You know, you do not want to get dehydrated post-surgery. And it's obviously going to help with your digestive system as well to keep things moving along. So those are just a few things that I would recommend. Quickly going back to the belly band versus faja, just make sure you do talk to your surgeon and find out what's going to be right for you. But yeah, that's it. I hope this little video was helpful. I hope I'm getting better on camera and less annoying. My long video was uploaded very, very blurry, and I think it was just due to the length. So hopefully these videos are more watchable. But thank you for watching. I hope they're useful. Speak soon.